Hi guys, welcome back to class. Um, now we have to squeeze in a lot of stuff in this next 1 hour, 1.5 hours. I want to finish Toxico so that it is taken care of and you don't have to do a lot of homework. हाँ fast fast पढ़ते हैं. No, yeah. I mean, aims. See, teaching is something which not everybody can do. It's not like everybody who knows a lot of stuff can teach well, and like everybody who teaches well knows a lot of stuff. Both of those things are not true, right? So I think it is something which comes to you naturally if it does, and it does to me, hopefully. Yeah, I mean, ऐसा है, हाँ, मुश्किल है teaching, है ना? So I think somebody just has it naturally that people can relate to, and hopefully I mean, that is what I feel, that whenever I talk, people can somehow remember what I say. That is one of those things which I have. I can't work at AIMS if I am into teaching. Both of those things can't go parallel. So like if you are in a government job, technically you cannot teach in any private coaching or any private center. So अगर AIMS में काम करना है तो teaching छोड़ना पड़ेगा. So that's why I never continued as a faculty at AIMS, because if I want to do that, then I have to give up on this. So that is what it is. But we have to be quick now. We can't chat much. Private practice नहीं कर सकते AIMS के साथ. For any government, for Delhi government institute Delhi, you can't do that. काफी states में like Rajasthan and all, you can do. Okay, बस अभी स्टार्ट करेंगे फटाफट, because lots to do. And after, as soon as this is over 8 o'clock को there is this new Ross का thing, so I have to go at 7:30 in that meeting also. So very very quickly 7:30 I'll have to stop. ठीक है, तो फटाफट स्टार्ट करते हैं. 5 minutes हमने ऑलरेडी निकाल दिए. हाँ, वॉइस एको नहीं है. आईपीसी का मर सब कुछ मैं बताऊंगी. ओके, हाँ, बाकी चीजें हैं जो विच वी हैव नॉट कवर्ड. वन इज ह्यूमन आइडेंटिफिकेशन. आई कवर फिंगरप्रिंट्स इन अ बिट, बट स्कल एंड पेल्विस से देयर इज जस्ट वन डब्बा दैट यू हैव टू डू. One table, for male versus female and what race. Do that. Secondly, sexual offenses, and that I have not covered. So those two things you have to do. Maybe somewhere down the line I'll try and cover in some special class. But those two things you have to study. Apart from that, jo bhi homework I will tell you. One is the stains, seminal stains and all. Pe I have taken one more. One is bone age estimation that you have to do. One is IPC, and one is ballistics. ये चार चीजें हैं जो homework है, which I've included in the end of the slide. Have I included that at end of the slide? नहीं किया तो बस मैंने बता दिया अभी. ठीक है, तो सुन लिया ना. बाकी आई विल टेल यू. सो आई हैव जस्ट एडिटेड द पीडीएफ बिकॉज अदरवाइज इट इज इम्पॉसिबल टू फिनिश. सो मैंने बस थोड़ा थोड़ा सा एडिट करके आई हैव जस्ट रिमूव्ड अ फ्यू नॉन इम्पोर्टेंट थिंग्स. ओके, या पार्ट 1 इज डन, पार्ट 2. सो न्यू पीडीएफ ले लो. सो पार्ट 1 में से कुछ कुछ निकाल दिया. ओके, ऑलराइट. सो देन वी स्टडी. हाँ, लास्ट में एक बार फिर से बोल दूंगी क्या क्या होमवर्क है. रमेश, व्हाट डाउट? नहीं. रमेश, रट लो, रट्टा नहीं मारना ना. समझ लो जो जो इंपॉर्टेंट है. कुछ कुछ चीजें व्हेन आई एम सेइंग दैट इट्स मोर फॉर आईएनआईसीटी, उसको छोड़ दो. सो डू प्रीवियस ईयर क्वेश्चंस एंड खुद ही समझ आ जाएगा कि क्या इंपॉर्टेंट है क्या नहीं है. बाकी मोर और लेस कंटेंट इज समथिंग व्हिच यू एवरीथिंग इज रेलेवेंट फॉर यू. ओके, चलो फिर शुरू करते हैं विद ड्राउनिंग वेरी क्विकली. सो वी आर स्टिल ऑन टू एस्फिक्सिया. या एस्फिक्सिया पे ही है. तो एस्फिक्सिया में ड्राउनिंग, पानी में गिर गया तो इज ड्राउनिंग. सो नाउ ड्राउनिंग कैन बी ड्राई ड्राउनिंग और वेट ड्राउनिंग. दिस डिपेंड्स ऑन लंग्स ड्राई है या वेट, क्योंकि ड्राउनिंग तो वाटर में होएगा, राइट? सो इट्स ऑलवेज गोना बी वेट. बट what kind of a death you have is dry drowning versus wet drowning, which is going to be on the status of lungs. So if the lungs are dry, means that the moment you hit water, you had a vasovagal response and you had laryngospasm. Vagal stimulation say you had a laryngospasm and the fluid never managed to reach the lungs only. So this is called as dry drowning, where you die of laryngospasm only because of vagal stimulation. Right. On the other hand, when you die because of pulmonary edema, because the fluid has reached the lungs and the lungs are filled with water, that is your typical wet drowning. Okay. Now, two important differences: if you drown in a freshwater lake or something, or you drown in a sea, right? So freshwater versus saltwater drowning. So which is going to be quicker? Which is going to be giving you a quicker death? Freshwater. So for say 5 minutes, right? So freshwater death happens in 5 minutes, whereas salt water will take approximately 10 minutes, right? So this is something that is one factor. Now, what happens in freshwater drowning? So anytime you are into fresh water, let's assume कि water आ गया हमारे blood में, right? So in the blood, in the capillaries, water is entering. So what will happen? Hemodilution is happening. right? Anytime there is hemodilution, lots of water in the blood, do you agree RBCs के अंदर water is gonna go inside, right? So RBCs are gonna swell up and they are gonna undergo what? They are gonna undergo hemolysis. Now, the moment you have hemolysis, what will happen? Potassium will be released. Yeah, so potassium is released from the cells here, and sodium and chloride undergo dilution. Because dilution हुआ था तो hyponatremia and hypochloremia. This is what is happening, right? So this is the status of electrolytes as far as freshwater drowning goes. So the moment you have hyperkalemia, you know how dangerous that is, right? So all the RBC is getting lysed. Sudden hyperkalemia, what will be the mechanism of death? Correct. Mechanism of death here is going to be via arrhythmias. All right. So this is what is happening in fresh water, and that is why the death is quicker. On the other hand, salt water में क्या हो रहा है? You have all the impurities, sodium chloride, which are coming into the blood. So now you are gonna have hemo concentration, right? More than the water, it's the sodium chloride and everything that is entering here, right? So now sodium is gonna be high, chloride is gonna be high, potassium is also gonna be high, right? All the impurities are coming. In addition, you will have strontium, you will have magnesium, and strontium is something which is quite specific, right, for saltwater drowning. So how the death happens? Because you have hemo concentration here, now you're going to have severe pulmonary edema. Correct. So here the mechanism of death is by pulmonary edema. Here the mechanism of death is by arrhythmias. All right. How can I distinguish them on autopsy? Okay, fine. So Dr. SN has solved that for us. That ideal is submental. That is what I had studied. In India, it is below angle of mandible. Perfect. ठीक है. So Gettler test में अपन क्या करते हैं? It is not diatom test. Diatom test is different. Here, we don't even check the weight of lung. In Gettler test, again, everything you're mixing up. In Gettler test, you have those two ventricles. Do you know our two ventricles? Right ventricle, left ventricle, है ना? हमारे heart में है. So normally, in some person who has not drowned, you will have normal concentration of chloride, both में equal chloride होगा, है ना, right and left ventricle में. What will happen in fresh water? So now I'm only testing left ventricle. तो fresh water में क्या हो रहा था? Hemodilution, right? So what was happening to chloride? Chloride was going to be low. Whereas salt water में क्या होगा? Salt water में chloride is going to be high. So basically you just have to see कि left ventricle with respect to right ventricle. What is the level of chloride? So if you find left ventricle में कम है, fresh water. So ज्यादा है, salt water. अंडरस्टूड? एवरीबडी कंफ्यूज तो नहीं हो गया? बेस्ड ऑन योर नॉर्मल हमारा जो पैथोफिजियोलॉजी हमने समझा कॉन्सेप्ट से, वी कैन आंसर, है ना? सो दिस इज द गेटलर टेस्ट वेयर वी गेट टू नो कि सॉल्ट वाटर है या फिर फ्रेश वाटर से डेथ हुआ. नाउ व्हाट इज द इमर्शन सिंड्रोम और हाइड्रोक्यूशन? The water only was so cold. The moment you stepped into the water was so cold कि वहीं पे डेथ हो गई. Because of vasovagal spasm, only because of the cold temperature, you had death. Right? So this is basically because of what? So this is because of cardiac arrest. Because of sudden vagal stimulation, you had a cardiac arrest and you died. So we already saw three things, है ना? Laryngospasm हो सकता है, pulmonary edema हो सकता है, and this is the third thing. When the temperature is too cold, cold lake में कूदे, vasovagal death से cardiac arrest हो गया. What is near drowning? That's not important again, but it would remain the same. But Gettler test, we are testing chloride. So near drowning is when you did not die by drowning, you died within 24 hours. After 24 hours of drowning, you died because of secondary things. कि drowning से तो बच गए, but you died because of maybe a secondary infection. You died because of hypothermia. You know, so any secondary factor that led to your death after you were saved from your drowning in episode. Okay, so that is near drowning. So do not get confused by all of these terms. Okay, now four changes which are very sure signs that antemortem drowning हुआ है, means your death has happened because of drowning. It's not like you were dead and somebody threw you in water. वो भी हम movies में देखते हैं. So antemortem drowning के sure short signs क्या है? Four signs. One, you will have frothing, right? So what am I showing you here? You will have frothing which is continuous, tenacious. So much water is in your lungs that it's constantly coming out, right? So you're going to have this tenacious frothy sputum which you are constantly emitting from your mouth because of the surfactants which have all gotten released. So this is going to be the tenacious froth, continuous froth. All right, very very important. What are you seeing here? When you hold glass and suddenly the muscle group goes into contraction, what is that called? Correct, that is called cadaveric spasm. Is this like what is the differential of this? What is the differential of cadaveric spasm? Is this like rigor mortis where it will have a specific sequence? ऊपर से नीचे आ रहा है, then it will resolve with time. No, this is always, this is gonna be fixed. ये हिलेगा ही नहीं. This happens when suddenly at the time of death, all your ATP is depleted. ATP ही deplete हो गया, everything got unlocked. So this is something which is cadaveric spasm, which is locked. Only one muscle group will be affected. Can it affect involuntary muscle also? No, this is only going to be involuntary muscle, very specific group of muscle, and this will not follow your timeline of rigor mortis. That is the difference. Okay. Second, do you see these lungs? Lungs are full of edema. What do we call that? Yeah. One, you are also seeing pleural hemorrhage that all of you have picked up. So this is Peltau's hemorrhage. P for pleura, P for Peltau's hemorrhage. Do you remember Tardou's hemorrhage, which was there in asphyxia in the conjunctiva? Yeah, so this is P for pleura, P for Peltau hemorrhage. On the other hand, the lungs are all filled with fluid. इसको क्या बोलते हैं? Emphysema, but emphysema was for lung. So what do we call this? We call it emphysema aquasum. Aquasum. All right. So water है. So aquasum or aquasum emphysema, because they're filled with water. They're not filled with air. Or no, it's not stuck. Is it stuck? No, no. Then there is one more test that we can do under microscopy. Durate hemorrhage कहाँ से याद आया अर्जुन? Durate hemorrhage is brainstem hemorrhage which happens in transtentorial herniation. है ना? बिल्कुल अलग. So what is this? This is diatom test. All right. So this is, maybe you are trying to correlate hemorrhages. Sorry, diatom test. So what happens is we have all of these algae and silica जो सारे में है. So which enter the body and these will remain in all the organs, right? So where we test this is bone marrow. तो bone marrow में जी देखेंगे diatom test, and there is one more utility of these. एक तो antemortem का sign है, plus one utility is that we can also match this. जिस लेक में वो बॉडी मिला उस लेक में देख लो, आर दीज डायटम्स प्रेजेंट देयर? सो दे आल्सो टेल अस इंफॉर्मेशन अबाउट द साइट कि व्हाट इज द साइट ऑफ ड्राउनिंग. ओके, सो वी कैन मैच एंड वी कैन फाइंड आउट. Okay, so this is one more utility of the diatom test. And what we do is we basically make them undergo acidification. So they are resistant to acidification, and that is how you can identify them. Okay, so this is about the four short signs of antemortem drowning. So diatoms otherwise are not specific, but when you see them in bone marrow, that is specific. That won't be seen in post-mortem drowning. Okay, so all four of these signs are specific to antemortem drowning. Two signs which are not specific to antemortem drowning. ये क्या हो गया? Washerwoman hands. No, you must have seen anytime you keep your hands in water for a long time, you will see कैसा सा wrinkling हो जाता है, नहीं? So that is washerwoman hands. So this is something which is very normal. This will be seen somewhere around 12 to 18 hours after being in water. On the other hand, what is this? You are seeing ki peeling of हो रहा है. So this is the kind of degloving which can happen. So this will be seen sometime अगर आप 2 to 3 days peeling off of the skin which can happen if you are in water for 2 to 3 days, right? So these are signs जो कि किसी में भी मिल सकता है. पानी में कभी भी गए हो, antemortem, postmortem, you can have these signs. One more sign which is not specific. What is cutis anserinus or goose flesh, right? So this is again something which happens because of erector spiny muscle, right? So this is basically जो erector pili, erector spiny नहीं, erector pili muscles हैं. The goose bumps, they will undergo in rigor mortis. उनका rigor mortis हो जाएगा जब, तो you will have goose flesh, right? Goose bumps हो जाएगा. So that is something which can be seen in anybody. All right. So these are the three changes which are not specific to antemortem drowning. Is this clear, everybody? क्या? Your comment is not seen. Okay, so now we go on to fingerprinting. So as far as human identification goes, remember, यहाँ degloving का मतलब है anytime the skin peels off, ना, that is degloving. So out of human identification, you guys have to do these two tables on your own. Somebody can post on the group. एक तो एक pelvis का आता है, एक skull का आता है, right? So identification of male versus female on both of these you have to see on your own. Okay, quickly somebody just post after the class is over. So ये हम अपने आप में खत्म कर देंगे. Going on to and dentition also. Dentition also you have to do. ठीक है, age estimation I have taken a video, I will post the link as homework. Okay, now going on to fingerprinting. So development in fetus कब तक हो जाता है? So this is complete by 24 weeks. So it starts by 12 weeks, but it is complete by 24 weeks fingerprint. Is fingerprinting amazing for identification? Yes, it's amazing for it's the best for identification. Why? Because it is not same in identical twins also. It is something जो कि identical twins में भी unique है, right? So it is something जो सबका अपना अपना है. All right. And what are the types of fingerprints that we have? Yeah, even if DNA is same, this will be different. Yeah, so there are three things that you need to know. One, can you see how it is all arching? Upar upar ja raha hai. So this is something which is called as arch. On the other hand, when you see that it's going around in circles, gol घूम रहा है, what is this? This is loop. एंड व्हेन यू सी कि दुनिया एकदम ही ऐसा वोल्ड आउट अपीयरेंस नहीं होता जो फाइब्रॉइड्स में मिलता है, मेनिंजियोमा में मिलता है, दिस इज वोल्ड. सो दिस इज वोल्डिंग, which is most common out of ALW. So they can ask you to identify these types of fingerprints. Loop is what is most common. Correct. All right. Now this question I think came in INICET. What happens to the fingerprinting, right? So what are the things which can change the distance between the ridges? These fingerprints can get altered also in your life. How do they get altered? Naturally, the distance can get increased if your soft tissue increase. Soft tissue increase किसमें हो सकता है? Acromegaly, infantile paralysis, rickets. Most important is acromegaly because acromegaly will have soft tissue increase. Complete loss of pattern can happen if you have burnt or if you have celiac disease. Okay, thoda weird. Permanent impairment of fingerprint, any injury, electrical injury, radiation injury or leprosy. Okay, ridge alteration. Ridges का alteration कब हो सकता है? So ये वाले pattern के नीचे you have ridges also. Okay, so ridges alteration can be seen in acanthosis, scleroderma, eczema. ये सारा just go through it once. It is not very important. Intentionally, how can you change your this thing? By using, by burning your finger, corrosive, cautery करने से या sandpaper से. So these are things that you can actually alter. So just go through this, not very important. Okay. Swati, not details are not very important here. Just go through this. Come as a one-liner question once. Okay, right. Now going on to quickly into autopsy and post-mortem. So these are the types of autopsy that we have. What is medico-legal autopsy? So this is the one that we do when we don't know the cause of death. What is the cause of death? The investigating officer doesn't know. So they will rely on the autopsy. Do I want to find, do I need consent here? No, consent is not needed, right? Because we are doing it to determine the cause of death. But if it's a pathological autopsy where I want to know for my own medical interest what is the cause of death, yes, then I need consent, right? So for a pathological autopsy, we need consent. So ये दो type हो गई. What is autopsy? It is something that we are doing a lot nowadays. In our trauma center at AIMS, we are doing something here. Yeah, so autopsy हम करते हैं, which is actually a virtual thing. You don't have to open the body. We do a whole body CT. MRI नहीं करते, whole body CT करते हैं, and through that, we try to identify what must be the cause. Okay, ये trauma में हमारा एक project था जिसमें हम ये करते थे. Then we have obscure autopsy. What is obscure autopsy? जहाँ पे आपने gross autopsy किया, you did not find any cause. So now you are sending for histopath, you are sending for lab analysis, and उसमें you found out the cause of death. What is negative autopsy? You did this also, but still you are not finding the cause. So cause is still undetermined, right? So we still don't know the cause. What is psychological autopsy? This is something that we would do. Yeah, so this is something we would do in suicides, right? To find out what must have led to this event, or was it really suicide? है ना? तो suicide का cause find out करने के लिए psychological autopsy is something that we do. Then the autopsy incisions, very important. So this is the most common. Negative मतलब मिला ही नहीं answer. We didn't know what was the cause of death. आया समझ में? Negative means we did gross analysis, we did gross autopsy, we did histopath lab, everything. Still the cause was not found. ओके हाँ, तो ये है मोस्ट कॉमन विच इज आई इंसिशन. ये बहुत इंपॉर्टेंट है. तो आई इंसिशन क्या है? चिन से लेके प्यूबिक सिम्फाइसिस तक, राइट? सो फ्रॉम द चिन टू द प्यूबिक सिम्फाइसिस एक सीधा इंसिशन दे दिया, फ्रॉम चिन टू PS. This is what is done most commonly. Question comes here. What is this? So this is your Y incision. Y बन रहा है. So this is your Y incision. Wherein what are you doing? You are going from the acromioclavicular joint and you are going till the sternum. So acromion is the buzzword here. So acromion se shuru kiya, sternal, and then you are going down. Yeah. So what happens here in Y incision? So in Y incision, basically the breast and the nipples are all spared, right? Yeah. So it is below the nipples here. So what happens? This is cosmetically better. So this is better for this is better for cosmetic indications for females. On the other hand, when we are doing this, when I'm taking from the yeah, this is modified y when I'm taking from the mastoid. Yeah, mastoid से शुरू कर रहे हैं and we are cutting till suprasternal notch. यहाँ पे sternum के below कर रहे थे. So here I'm cutting in the suprasternal notch and then it is straight. So this is useful for what? Here the neck is completely intact, right? So this is very useful for neck dissection. Yeah, so this is modified y. Yes, I know there is a controversy because some forensic teachers have taught कि ये वाला indications are different. Modified y इसके लिए, y इसके लिए है. But some teachers have also taught it ulta. So I don't know if forensic specialist cannot agree, then who am I to tell कि भाई ये सही है ना? तो ये this is on you. Whoever you follow, you can just basically see. मैंने तो ये choose कर लिया because this is what is given in Sumit Seth. Have you read this book, Sumit Seth Kami? This is छोटा सा book. That is what I follow. ठीक है, तो वो अच्छी है. तो I incision, Y incision, modified Y. ठीक है. Now removal of organs. So removal of organs, you have three techniques. Very important. Virchow's technique, sequentially jao, one by one. So you remove head first, you see thorax first, then you see abdomen. So this is what we follow. So this is Virchow's technique. Rocky Tansky में क्या कर रहे हैं? पूरा पूरा एक साथ part निकाल रहे हैं. Now here there are two other, right? So this is in, all right. So Rocky Tansky is when en bloc nikal rahe, but in situ. We are not removing anything. So why do we want to do in situ where we are not removing the organs? This is very useful in cases of infections. जैसे बंदे को HIV है, more important in cases of COVID, right? Very relevant to us now. So in COVID-19, we don't want to be exposed. So that is why we'll do an in situ autopsy here. Then two words. One is letules, wherein one is letules and the other one is gons, right? So remember, L and LM are together. So letules is when we remove en mass. एक एक साथ साथ निकाल दो पूरा पूरा organ. Whereas gons is en bloc. ठीक है? Right, so just remember this, n block, n mass. बस खाली याद रखने के लिए इतना याद रख लो, L and M, LMNOP, L and M stick together. So letules is n mass, gons is n block. Most important is in situ. Rocky Tansky कब करेंगे? In infections. Virchow is one by one, most common. ठीक है? Yeah. All right. Now order. In which order? So there are certain modifications to the order that we need to know. So poisoning में हम क्या करेंगे? So poisoning में what is something that we would want to do first? Correct. So here the cranial cavity or the brain is exposed first. Why? So that we get to know the smell also, right? So cranial cavity se smell aega apparently. So we want to know the smell of the poison, right? So this is what is done first. What do we do in newborn first? In newborn, we actually open the abdomen first. Why? When I open the abdomen first, I know the position of diaphragm. Why is that important? That is very important to know whether it was a stillbirth or baby took the first breath. So if it was a stillbirth, baby never took a breath, we will see the diaphragm position differently, right? So that is something which is very, very important. Okay. Air embolism में हमें क्या special चीज करना है? Here we do something called as a pyrogalol test. What is a pyrogalol test? So pyrogalol test is something in which I open up the pericardium, right? So I open up the pericardium, the heart, and I aspirate and I inject this pyrogalol compound into the pericardium. If there is air, this pyrogalol compound will become brown. All right, this changes the color. So I know that there is air in the pericardium. So this is what we are doing in air embolism, wherein I am opening the pyrogalol, and if there is air, it changes the compound. Asphyxia में क्या change करना है? Position of diaphragm, वो तो like no specific position, but it will be different. Okay, asphyxia में correct. We want to see the neck last. All right, so as to determine whether it is. Do you remember antemortem versus postmortem, or do you remember hanging versus strangulation? In hanging, it was completely parchment. It was hard, bloodless, right? Pale. Whereas in strangulation, it'll be bloody with a lot of inflammation and all, right? Apart from the color. So we want a completely bloodless field in asphyxia. So we are studying the neck, the last. What do we do in pneumothorax? Pneumothorax, may we just want to examine chest first, and we use a technique which is called as pocket dissection. Can you see this? So we do a pocket dissection on the affected side, and if air is present, you will see bubbles. Okay, so just remember the term pocket dissection. So these are definite questions जो एक question हमेशा आता है इनमें से. Fine. So everybody just keep this in mind. What are the other maneuvers you do depending on case to case? Quickly going on to postmortem thanatology. I'm sure you guys know. तो ज़्यादा टाइम नहीं स्पेंड करेंगे. So there are three phenomena which happen early after death. TSD is time since death. So what is this? Yes, so this is not tachynoir. What is this? This is railway tracking. One more railway tracking that we are seeing today. One more name for this. Who will tell me what is this phenomenon? This was a repeat question. When I was preparing for AIMS, ये सवाल आया था. Yes, this is Kervokian sign. So this is called as Kervokian sign, wherein you will have within the retinal vessels there is this segmentation. Stagnation of the blood happens within the retinal vessels. So this is Kervokian sign or railway track. Importance क्या है? Same नेहा, no difference. This is the earliest sign that you can have after death, right? So this happens in matter of 1 hour. Yeah, so this is about 1 hour. This is the earliest sign that you will have. What is this sign? Image based question aega, where you see this bluish pigmentation in the sclera. This is tachynoir. So this is the tachynoir sign that you have, and this occurs sometime around 3 to 6 hours. What is this? This is something where the eye becomes completely opaque all over earlier, all over. This is the first sign to develop पूरे body में. आई में वैसे ही जल्दी आता है compared to anywhere else. This means eye opaque, which happens after 6 hours. All right, so less than 1, 3 to 6, more than 6. But if I ask you कि best क्या है to determine time since death, something that correlates linearly with time since death, it is the vitreous humor potassium levels. Very complex. Not even IOP. Vitreous humor लो, उसका potassium नापो. That correlates linearly with time since death. All right, so this is the best if somebody will ask you. Okay, so these are all the eye changes after death which are very important. Again, one question from this always comes. Then algor mortis. What is algor ka meaning? Algor means cooling, right? So the body becomes cool after death. So what is the ideal site to measure the temperature? टेम्परेचर कैसे मेजर करेंगे, कहाँ पे मेजर करेंगे? सो इट इज सब हिपैटिक साइट, एक्चुअली जस्ट above the liver. Sub hepatic space is the ideal site to measure the temperature, but obviously वहां पे बहुत मुश्किल है. So most commonly done is rectum, right? So rectum is the most common जहाँ पे हम measure करते हैं. What is the rate of cooling? So rate of cooling will depend on the season also. So अगर summer है, it is something like 0.5 degrees Celsius per hour, whereas if it is winter, it is 0.7 degrees Celsius per hour, right? So this is something which is, yeah, what ma'am wrote beside potassium, linear. It correlates linearly with time since death. Okay, so this is the rate at which you lose temperature. However, is this something which happens immediately? So earlier thought was कि ऐसे जा रहा है, but this was the older thought. The newer data showed that no, it is not like that. For the first 2 hours, the body remains hot. So that is called as post-mortem caloricity, isn't it? So that is called as post-mortem caloricity, where the body starts to lose heat after the first 2 hours, and then it starts to lose heat, and again it is not linear. So you are seeing कि यहाँ पे plateau है, then it loses heat rapidly, and then again it slows down after 24 hours. So this type of graph is flipped S shape or inverted S shaped graph. All right, so they can ask you various graphs which I will teach you in a bit, but remember, for post-mortem cooling or algor mortis, it is an inverted S shaped graph. Where will you have that it is not cooling rapidly, धीरे धीरे cool हो रहा है? So G1, basically this is how the cooling is happening. It's not immediately 0.5 to 0.7. For the first 2 hours, it remains hot. After that, the dip in the temperature will be there, but it again slows down towards the end. So overall, there is this inverted S-shaped graph that we get. Correct. This is seen when you have a lot of muscle contraction, like something like strychnine poisoning, isn't it? Where else will you have a prolonged increase here of temperature? Strychnine ka hi bhai, if you have tetanus, right? And if you have a heat stroke. Remember, heat stroke, your core temperature only was very high. Usse death ho gayi. Again, you will have prolonged increase. But if I ask you burns, patient was also, burns may be hot hona chahiye tha. Will burns have prolonged increase here? No. So this is what will be your all except question, that burns will have your normal decrease in temperature. There is not a prolonged increase of temperature here. So these are the three most common causes which are there. No, no, nothing else. Drowning कुछ नहीं. Drowning में तो जल्दी cool हो जाएगा ना. So these are when you do not have any, these are the only three causes where the cooling is not very quick. Burns में there is no prolonged increase in temperature. Okay. So this is about the prolonged increase of post-mortem caloricity. That, let me write that. ठीक है. So जो post-mortem caloricity था, which was normally 2 hours, that will be more in these three, but not in burns, not in lightning, nothing. है ना. अब एक एक मत पूछो. All right. So this is about that. Fine. Livor mortis क्या है? Livor mortis is the dependent collection of blood, right? So this is when you have blood which gets collected. Okay. So this is the staining that you have. Okay. Sorry guys, 1 minute. Yeah. So livor mortis is also called as sugillation. This is a repeat question. Ki what is sugillation? So sugillation is the same as livor mortis. Third like garmi ho rahi. My AC was not in the optimal setting. Hypostasis, post-mortem lividity. So these are all synonyms. All right. So कैसे होगा? This will be in the dependent position, right? So we have already seen this कि dependent position में आएगा. So if the person is on the back, normal तरीके से मरा है इंसान. So where will I see? I will see that it is on the back and it is on the dependent position. Most important क्या है? Most important है अगर hanging से death हुआ है. Where will you see post-mortem lividity? Glove and stocking. Remember this phrase. It will be in a glove and stocking distribution. Okay. Where is livor mortis absent? Important potential question. Yeah. So okay. So it will be absent. Yes. If you are in a flowing water, pani se body is constantly moving. What if you've died of hemorrhagic shock? Blood ही नहीं बचा. Hemorrhagic shock हो गया. Or what if you are extremely anemic, severe anemia? Still you will not have this redness only. All right. So livor mortis is again something that is evolving. When do you say that it is fixed? कि अब इतना हो गया, इतना ही रहेगा. So fixation is after 8 hours. All right. So 8 hours is the time when it fixes. ठीक है, नॉन ब्लैंचेबल हो जाता है. सो दीज आर द पॉसिबल क्वेश्चंस ऑफ पोस्टमार्टम लिविडिटी. अब कलर पे क्वेश्चन आता है डिपेंडिंग ऑन कलर. सो वन इंपॉर्टेंट इज चेरी रेड, राइट? सो चेरी रेड लिविडिटी, कार्बन मोनोऑक्साइड. Chocolate lividity, remember anything with nitrogen. So potassium nitrite, nitrobenzene, bromates, potassium bicarbonate, these are all which show you chocolate color. Bright red for cyanide. Remember for cyanide it is bright red. Bright pink is for anything which is cold, refrigerated, cold water, hypothermia, bright pink. इतना याद रख लो. बाकी एक बार जस्ट गो थ्रू दिस टेबल इफ यू वांट. मोस्ट इंपॉर्टेंट तो कार्बन मोनोऑक्साइड ही पूछते हैं बार बार चेरी रेड. ओके. This is very, very important. Now all the graphs with respect to time. So one have we done postmortem cooling. What is the shape? So सबका shape पूछते. So postmortem cooling का shape कितना था? Initially 2 hours static and then it will be sudden and then it will again slow down. So this was sigmoid or reverse or inverted S, right? Flipped S shape. Perfect. Then let's look at postmortem lividity. पोस्टमार्टम लिविडिटी का कैसा कलर है? दैट इट गेट्स फिक्स्ड बाय 8 आवर्स एंड देन इट इज फिक्स्ड. है ना, हमने देखा था फिक्सेशन कब हो रहा है? समवेयर अराउंड 8 आवर्स. सो दिस इज गोना बी फ्लैट आफ्टर 8 आवर्स, प्लेटूइंग और फ्लैट ग्राफ. ठीक है. देन लुक एट प्यूट्रीफैक्शन. प्यूट्रीफैक्शन कैसे हो रहा है? इट्स अ लीनियर ग्राफ, इजंट इट? सो आफ्टर 18 आवर्स इट इज गोना लीनियरली इंक्रीज. सो शेप ऑफ प्यूट्रीफैक्शन लीनियर. On the other hand, look at rigor mortis. राइगर मोटिस का कैसा है? इट इज अ पैराबोला. है ना, ये पैराबोला होता है, हाइपरबोला नहीं होता. पैराबोला व्हेन बेसिकली इट इज गोना इंक्रीज विथ टाइम एंड देन इट विल लूज आउट. है ना, तो राइगर मोटिस बिकम्स मैक्सिमम अराउंड 18 to 24 आवर्स एंड देन इट गोज डाउन. सो दिस इज योर parabola shape. Will you remember this and will you be able to identify? If I was an examiner, I will put this question. इससे मेरा पूरा पोस्टमार्टम थैनाटोलॉजी का अंडरस्टैंडिंग हो गया, राइट? सो 4 ग्राफ्स देंगे and you need to know everything in order to answer this question, right? So that is how good questions are formed. Okay, so this is about that. Rigor mortis versus cadaveric spasm we have already done. So rigor mortis starts 3 hours after death. Cadaveric spasm कैसे था? Immediate. Why immediate? Because complete exhaustion of ATP had happened. Was this a specific group of muscles which was voluntary muscles only? Yes. यहाँ पे all muscles are getting affected, isn't it? So this will happen anytime you have sudden excitement, violent struggle, you know. So anytime something is happening in one group of muscles before death, it will happen. And this is so marked that you cannot overcome it. And this indicates manner of death and last action taken by victim. Okay, can you just see this? Yeah, rigor mortis peak is somewhere around 18 to 24 hours. Okay, but it will depend on organs. So it will start craniocaudally, her organ may spread karega after 3 hours. Okay, so this is about that. So when I show you something like this, they will ask you an image based question. What is this? This we have seen in drowning also. So this is cadaveric spasm. This is a very very important question जो दो बार आ चुका है एग्जाम में. Somebody asked on the group also. What is this? Yes, this is marbling. So what is marbling because of? One was identify phenomenon. Second question was marbling क्यों हो रहा है? Because in the blood vessel, correct, you have sulf hemoglobin, sulf meth hemoglobin, right? So sulfur के कारण, sulf meth hemoglobin के कारण you are having this marbling within the blood vessels. Okay, now three types of decomposition. What is this first kind? First kind of decomposition क्या है? This is putrefaction. Is putrefaction good? No, putrefaction is not good. Yeah, same image, not the Google Wikipedia image. So putrefaction, remember, will it preserve any organ? No organs are preserved in putrefaction. What kind of smell? Smell, very, 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 very bad smell, right? So the smell is also something which we will not like, ugly, foul smell. On the other hand, what is this? This is adipocere, right? So this is adipocere. What happens in adipocere? How is the preservation of organs? Better preservation, right? Better preservation of organs, better than putrefaction. What about the smell here? Yes, you have a very sweet sort of a smell, sweet or rancid smell यहाँ पे मिलेगा. And what is this? This is mummification, right? So in mummification, what happens? This is the best preservation, right? So best preservation of organs will happen. And कैसा smell आएगा? No smell, odorless, right? So these are the questions that can come from decomposition. All right, fine. What is Casper's dictum? So here you want to remember the ratio of 1 is to 2 is to 8. What is the ratio of decomposition? So decomposition is to air. Yeah, just read that, no part. So air followed by water followed by earth, मतलब soil, है ना? तो अगर दफना दिया 8 times faster decomposition, water 2 times faster decomposition if air is 1. All right, तो ये है. Okay, so this is about the Casper's dictum, which is 1 to 8. That is what you can remember. Or 128. Good mnemonic. All right. So ये rate of decomposition है. Just one list for you. No need to remember पूरा list. But what is the order? ये भी सवाल शायद आया हुआ है. What is the order of putrefaction or decomposition of organs? So just we want to remember larynx and trachea will be the first. Okay, so these are the first one which will putrefy. So order of putrefaction, there is one long mnemonic. Do you want to remember this? If I was in your place, I would not remember this. कि ये छोड़ दो. बस खाली first याद रख लो कि larynx and trachea है. बाकी last भी देख लो. So last organs कौन है? Prostate in males and uterus in females. All right. Bones are the last organs to putrefy. Okay, so last soft organs, prostate and uterus. Bones are last overall organs. तो बस खाली इतना याद रख लो first and last. बाकी बीच का order कौन करेगा? Okay. All right. Now toxicology. Quickly you want to do, so good time at least. So toxicology फटाफट कर ले, ठीक है? चलो. So corrosive, इसमें सब फ्लैश कार्ड है, फटाफट आइडेंटिफाई करेंगे सब लोग. Now when we talk about corrosives, we have acid, we have alkali. Which is more dangerous? Yes, alkali is more dangerous. Why? Because it undergoes, it causes tissue necrosis. By what mechanism? L for liquefactive necrosis. So बहुत ज़्यादा necrosis हो जाता है. Whereas acid, so C से it causes coagulative necrosis, right? So what happens is, because of coagulation only, it forms this eschar where the necrosis itself will stop, isn't it? But there is one exception which causes both. Which acid causes both coagulation as well as liquefactive necrosis? It is HF, right? Hydroxyfluoride. So this is the one which causes mechanism by both coagulation as well as liquefactive. Now within acids we have inorganic acid. जो हम inorganic chemistry में पढ़ते थे, H2SO4, HNO3, HF, ये सारे ही कैसे हैं? They are gonna cause mechanism of action as local effects, right? कि local effects ज़्यादा होंगे. फेंका किसी पे acid, you have local skin effects. जहाँ पे भी acid will go, you will have local effects. But what about organic? Something like You can just do this and it'll be enough. Organic में क्या करेंगे? Yeah, organic like oxalic acid, carbolic acid, you know. So इनका क्या है? They will cause more systemic effects. Here also exception is what? HF, where HF will cause systemic effects as well as local effects. Okay, so remember that about HF. So we'll see each one of them now. So what is this spotter? Whenever you see black discoloration and white teeth, this is the strongest acid. So this is what H2SO4 will do. It is also called as oil of vitriol. Why? Because this is the agent which is most commonly used for vitriolage. It also causes a blotting paper, very thin blotting paper stomach, and that is why what happens? Stomach perforation is most common here. Spotter, wherever it touches, skin will become black. One more area where you will see this, where the skin is black, it will be cocaine, right? So remember, cocaine and H2SO4 दोनों में skin black हो जाएगा. But what about teeth? Teeth becomes chalky white. Teeth become white. What is the antidote that you want to give? You can give zinc oxide or magnesium oxide as antidotes. So this is what we want to know about H2SO4. Remember, blotting paper stomach. What poisoning when you see yellow color? This is HNO3, nitric acid. Why is it causing yellow? Because it causes a reaction called xanthoproteac reaction and it produces correct picric acid. है ना? तो picric acid के कारण wherever it touches, it stains it yellow. That is the only question that they can ask. Skin looks like boiled lobster. Repeat question, पुराना question. बो से boiled lobster, बो से boric acid. So boric acid का एक ही point याद रखना है, boiled lobster appearance. Next, very important, lots of facts. Phenol जिसको बोलते हैं, phenol पोछा लगाने के लिए we use, पोछा is mop, it is carbolic acid. So comes as phenol. Otherwise, normally chemistry wise it is crystals, but we use it as a liquid. Okay. So one thing, it causes meiosis, very important. Second, PCT का necrosis कराता है. It delays putrefaction. Remember what can delay normal putrefaction? Carbolic acid, alcohols. Alcohols can also delay putrefaction. There are other things also, but remember these two. Marasmus it will cause if you are taking carbolic acid on a chronic basis. थोड़ा थोड़ा phenol रोज पी रहे हो तो marasmus हो जाएगा. It causes leathery stomach. Very important. So can I do a lavage here? Yes, this is the only acid where you can actually do a lavage. Can you do lavage for any other acid? No. If you put anything for lavaging, your stomach will perforate. What is the tube which is used for lavage? Gastric lavage के लिए जो tube use करते हैं, उस tube का नाम क्या है? Yeah, it is called as Eswald's tube, right? So it is called as Eswald's tube. Okay, so remember, lavage is contraindicated in all corrosive poisonings except for carbolic acid. Except for carbolic acid, everywhere else it is contraindicated. Okay. Now, if what will it do to the urine? PCT necrosis has, so urine immediately will be green, but if you allow it to stand, it becomes black. Why? Just because of, just like which other inborn error of metabolism? Alkaptonuria है ना. तो alkaptonuria की तरह ही here you will have the deposition of these metabolites. These are metabolites of carbolic acid which make it black, and in chronic cases you will have ochronosis. Alkaptonuria में भी ochronosis है, where you have sclera turning black, cartilage turning black. All right, so that is something that you will see here also. Okay, will you remember everything about carbolic acid, guys? Important चीज है. Meiosis, leathery stomach, black and green urine and ochronosis. ठीक है, तो ये है. हो जाएगा याद, एक दो बार पढ़ लो, हो जाएगा पक्का. Because these are all images ना, तो image ना एग्जाम में याद आ जाता है. If you keep doing the same thing, that is why doing the same thing again and again is so important. your visual memory में चला जाता है, फिर आप भूलते ही नहीं हो. You know, like अब मुझे like this is the second third time I am teaching toxico, perhaps तीसरी बार क्लास ले रही हूँ toxico की. पहले दो बार मुझे पढ़ना पड़ा, इस बार मुझे पढ़ना भी नहीं पड़ा. द मोमेंट आई सॉ द पीडीएफ मुझे याद आ गया था चीजें, राइट. सो बेसिकली यू आल्सो हैव, दैट इज द सेम फॉर यू आल्सो. 3 बार पीडीएफ देख लो, याद हो जाएगा. एक बार सुन लो, एक बार और सुन लो, फिर बस पीडीएफ देखोगे एग्जाम से पहले. दैट इज ऑल दैट यू नीड. सो इफ यू कैन डू दैट फॉर दिस एंटायर कोर्स, लिसन टू इट मे बी ट्वाइस, So it will go into your head also, and then just revise the PDF before the exam and you will be set. I am telling you. उसके ऊपर बस आपको extra चीजें करनी है जो हमने नहीं करी. You have to do previous questions and add to the notes whatever is left. Okay, so that would be the golden rule. Okay, yes, I'll avoid Hindi. Pinpoint pupil. So what are all the causes of pinpoint pupil? Formaldehyde, barbiturates, fb.com is your mnemonic. Carbolic acid or phenol, organophosphorus, opium. Okay, yeah, pontine hemorrhage also is one of the causes. Okay, I'm getting tired. The pontine hemorrhage, so carbolic acid or phenol, organophosphorus, remember, very important, opium. Okay, so these are all the causes for pinpoint pupil. Okay, what is this? Spotter? Correct. We are talking about oxalic acid. So oxalic acid na is like white powder. Salt जैसा भी लग रहा है, sugar जैसा भी लग रहा है, right? So this is like salt and sugar. So two names here. So this is called as salt of sorrel and sugar of acid ऐसा नाम रख दिया. Alright, so these are the two names which it has been referred to. It is used as an ink remover in forgeries. Okay, so ink remover की तरह use करते हैं. That is also a repeat question. What will it do to the stomach? Stomach becomes brown. So vomitus कैसा आएगा? Coffee ground. Again, organic acid, so it will cause hypocalcemia. Why? Because it forms calcium oxalate. Alright, so calcium को sequester करता है to form calcium oxalate, and because these crystals are going to deposit in the tubules, it also causes tubular damage and oliguria. Antidote क्या है? Because calcium is getting lost, so you want to give calcium gluconate 10%, right? So 10% calcium gluconate is the antidote here. Okay, oxalic acid, very important. What is this which had both? Coagulative necrosis. It also causes systemic effects like hypocalcemia, hypomagnesemia, hydroxyfluoride. Very nice. Very quick revision. Black stomach mucosa kahan pe tha? Where did you have black color everywhere? Blotting paper, black color, H2SO4. Yellow stomach, nitric acid, picric acid. Leather or gray, the only non-contraindication of lavage, carbolic acid. Two more areas. So anywhere we see green, no, so far aage kabhi bhi it is going to be because of iron, right? So iron toxicity, green. Blue green, anytime you're dealing with copper. So copper sulfate most commonly is going to be blue green. Okay, so this will be true for everything. Stomach hi nahi, sab kuch hi. All right. Quickly going on to asphyxiants. What is it that we are talking about? Cherry red lividity. Carbon monoxide, most common asphyxiant. What will it do in MRI? This is MRI. You are seeing the globus pallidus, right? So this is the level of lenticular nucleus. So lenticular nucleus medially we have globus pallidus. So what it does is it causes bilateral global pallidal necrosis. Okay. Third image, what does it do? So normal hemoglobin, does it have high affinity to carbon monoxide than oxygen or low affinity? It has 250 times higher affinity, right? So will it release oxygen? Will it allow oxygen to be released? No, right? So that is why what is the kind of shift that we will have? You can see here that it causes a left shift because oxygen is not getting dissociated. And what will happen to saturation? Obviously, because oxygen is not getting released, the saturation will be low. So remember, carbon monoxide, what does it do to the oxygen dissociation curve? Leftward shift and downward shift. याद रखोगे ये चीज? Okay. What kind of anoxia will you have? अगर oxygen release ही नहीं हो रहा, you have anemic anoxia, right? So this is anemic anoxia. When we consider normal limit of carboxyhemoglobin in our blood, this is going to be 0.01%, right? So 0.01% of carboxyhemoglobin is something which is normal. Death कब होती है? So that is the Balthazar-Nicholas coefficient, where more than 60% is going to be fatal. It causes death. No, not histotoxic. That's cyanide. We'll get to it. Okay. So this is what causes death. What is the treatment of carboxyhemoglobin? 100% oxygen, right? You can give hyperbaric oxygen or just oxygen. No. Lily's kit and all, don't confuse here. Okay. Yeah. Leftward shift, it decreased. Both same thing, no HM. Agar higher affinity hai to decrease dissociation. Same thing only. Now, if it is 100% hyperbaric oxygen, what will happen? When I give oxygen, too much oxygen, carboxyhemoglobin will start to dissociate, right? So hemoglobin will start to be okay, right? It will start to have oxygen. So this will start to dissociate. But what is rebound effect? After a while, myoglobin also starts to have carbon monoxide, right? So the rebound effect is you again start to have symptoms because the myoglobulin is going to take the carbon monoxide. So that is the rebound effect where the dissociation for myoglobulin will then begin. Okay, so just remember this is because of myoglobin also binding to the carbon monoxide. Okay, right. What are the tests which are used? Three tests. सब में L आता है, remember. Saylor test, Kunkel test, Wetzel test. Alright, so these are the three tests that we have. Skin blisters होते हैं. So there are two things which have skin blisters. One is carbon monoxide and the second one, correct, is barbiturate. Right, so there are two agents which produce skin blisters. I'm just going to bring this closer. My voice is going. Okay, so this is about carbon monoxide poisoning. Now, what is this? This is the second asphyxiant, which is cyanide, right? Cyanide toxicity. So cyanide, did we see brick red color? This is going to have brick red color of post-mortem lividity. Cherry red tha, ye brick red ho jayega. Yes, this is the ideal suicidal agent because it's painless, it's quick, right? It has a bitter almond smell. Mechanism of action iska kya hai? So this is going to be histotoxic anemia. How? Because it blocks your electron transport chain, right? So it blocks the cytochrome C oxidase, isn't it? So this is what it's going to block, and it will block the electron transport chain complex 4, isn't it? Yeah. So what will it do to ABG? ABG में क्या हो जाएगा? You will have lactic acidosis, right? So because lactate is accumulating, you will have high anion gap metabolic acidosis. So this is HAGMA. What will happen to pupils? Did we read it in fb.com? नहीं ना, तो meiosis तो नहीं है. So this is going to cause mydriasis. Now, normally if I want to commit suicide, how will I take cyanide? I will take sodium cyanide or potassium cyanide, right? What happens is these compounds will go into stomach and they will form HCN. This is how toxicity happens. But what if somebody has achlorhydria? वो PPI खा रहे हैं, उनको achlorhydria हो गया. Will they have HCN? No. वो उनका suicide ही नहीं हो पाएगा. So remember, achlorhydria is protective, right? Because HCN बन ही नहीं पाएगा. Understood? So achlorhydria is protective. Yeah. Suicide करने वो भी नहीं हो पा रहा. Then we have Lee Jones test, in which we use Prussian blue reagent. All right, so this is something which is Lee Jones test. Okay, right. From Lee, you want to remember one more, that cyanide is present in linseeds, right? So linseeds is one place where you have cyanide. Yeah, look like flaxseed, but these are different. Linseed. And then there are other agents like almonds, क्योंकि bitter almond था, apricots, right? So these are also agents which are going to have some amount of cyanide, so do not eat too much almonds thinking कि rank तो almonds से ही लाएंगे. No, because almonds have what? Almonds have this compound which is called amygdalin, है ना? तो amygdalin and emulsin मिलके you ate a lot today. मम्मी का तो यही impression ना. Our mothers think that we are not getting rank because you are not drinking water and you are not eating badam. इसीलिए तो rank नहीं आ रहा, वरना तो wait कर रहा है rank. मम्मी को समझ ही नहीं आ रहा. It's amygdalin and emulsin, right? So these are two agents that will combine and they will form toxicity. Okay, right. So remember this. हाँ तो टेक पीपीआई ऑल्सो, करेक्ट. अगर आलमंड बहुत खा रहे तो पीपीआई भी साथ में खा लो. वेरी नाइस. नाउ हाउ डू यू ट्रीट इट? सो यू ट्रीट इट यूजिंग अ किट कॉल्ड Lily's kit. Okay, so Lily's kit has what? Lily's kit has three things: amyl nitrite, which is inhalational, and sodium nitrite and thiosulfate. So what are we doing? We are giving nitrite. We are actually causing some more poisoning. ये cyanide काफी नहीं है, myth hemoglobin भी बनो. So nitrites will combine with hemoglobin to form myth hemoglobin. This will combine with cyanide to form cyan myth hemoglobin, and then I'm giving thiosulfate also, which will excrete the cyanide as thiocyanide. So बड़ा चाल चल के we are excreting cyanide. Alright, so I'm first producing meth hemoglobin and then I'm doing this. ठीक है? हाँ ठीक है, खा लो यार, पीगे वाले खा लो. Right, so nitrites, methemoglobin, thiocyanates. What is this? This is B12, right? So hydroxocobalamin B12 injection is also something which we can give, and there is one more compound called PAPPA, PAPA. Alright, so PAPA, Lily और B12, ये तीन चीजों को देना है for treatment of cyanide toxicity. ठीक है? Okay. What is this? Sewer gas. PAPA is a compound. PAPPA. Okay. वो नहीं करते dual marker में PAPA. So this is H2S. Yeah. So this is called as sewer gas, which is also used in Japanese detergent suicide. Okay. So rotten egg smell bhi aata hai. That is why this image, ऐसे अंडा नहीं डाला, it has rotten egg smell. I'm sure you all know that from chemistry, right? Yeah, good question. But sometimes you might have patients who are not dying in minutes, right? Sometimes you can have patients who have not taken a lot of cyanide. Okay. Right, H2S. Okay, now shall we go into snakes? Snakes में भी हाँ PPI वाले snakes में भी कभी कभी identification और question आ जाता है, तो बताओ सांप कौन सा है. So anytime you have this hood है ना, तो hood बन रहा है. So yeah, the study is called ophitoxemia of snakes. Okay, तो hood है मतलब cobra है. अब cobra में you have to see, are they wearing specs? So if you see specs, is it king or is it common? Only common people can wear specs, right? Have you seen kings wearing specs? No. So this is common cobra. What is this? Hood but no specs. So this is king cobra. ये कौन है? What is this? This is Causehi crate. This is your crate, common crate. But when you see yellow bands, what is this? This is banded crate, right? So this is banded crate. Why are all of these cursed together? Cobra, king cobra, crate, banded crate. Because all of them have what kind of toxin? Correct. All of these are neurotoxin. So इनको क्या बोलते हैं? This category is called as what? This category is called as Elapidae. Elapidae consists of crates and cobras which have neurotoxin. So they are going to produce what kind of paralysis? They're going to produce commonly descending paralysis, and ptosis is going to be something which is going to be an early sign. Can they have local effects which are missing only? जहाँ पे सांप काटा वहाँ पे कुछ हो ही नहीं रहा. So local effects can be missing here, right? So this is about neurotoxin. On the other hand, look at this. ये सांप ही अपना नाम बता रहा है. The सांप itself is telling its name. This is V. Can you see this V here? Yeah. So this is viper, right? So this is Russell viper or any viper. So this is your viper. Verse viper, verse neurotoxic. Okay. Vascular toxic क्या है? Answer क्या था? Because it's such a confusing question. Vascular toxins, vipers are vascular toxins, right? So vipers are your vascular toxin, which will have a lot of local effects, right? They will have hemolysis also. On the other hand, your sea snakes, which we call as hydropidae, these are called as hydropidae. इनका कोई category नहीं होता. So these are sea snakes which have myotoxin, right? So this will cause muscle necrosis. So these are your hydropidae. Okay, so understood about snakes. Will you identify all of them? Sea snake तो sea पे लेटा हुआ है, वैसे ही पहचान लो. Okay, right. Now, how to identify poisonous versus non-poisonous? So this is the heights of what they expect from us as medicos, that we identify also कि snake poisonous है या non-poisonous है ना? तो scales को भी देखो, ये भी study करो. तो poisonous snake head scale will be variable. So here you want to remember, do you know relatives in the form of very big fat uncles and aunties who will come to your house and they will ask you कि बेटे का कितना rank आया है ना? So these are people who will come for dinner at night and they will ask कि बेटे का कितना rank आया, बेटी का कितना rank आया, कब हो रहा है selection, what are you doing in life, right? So these are your poisonous snakes in life. So इनका abdomen कैसा होगा, belly scales कैसे होंगे, very large, right? So this is going to be very large belly snakes. And when do they come? Dinner, nocturnal, right? How many do they have fangs? Obviously fangs are तभी poisonous है, and fangs have to be canalized. On the other hand, प्यारे प्यारे लोग non specific time पे solid teeth, no fangs only, small stomach, small abdomen, but head is large. So these are good non poisonous snakes. All right, now heights देखो of questions which have come. Look at this. They have asked that identify the snake. This is snake's face, identify. So you have to see that this is your infralabial. No, this is your lip. This is your supralabial. Third supralabial scale, right? Third supralabial scale is the largest. So identify the snake on the basis of this. If the third supralabial scale is the largest, this is your cobra, right? So this is how you identify cobra here. And if you see कि नीचे के तीन scales जो है, they are equal. What is this snake? This is your crate, right? So these are your infra, this thing, this is your crate. बस खाली just see these images and that is what they can ask you. Okay, so ये हमारे सांप हो गए. Now, how do we treat? This is where we actually come in. So the agent of choice is going to be ASV, anti-snake venom. So this is effective. This is produced in India by against these four snakes: cobra, crate, Russell viper, saw-scaled viper. So these are the four common things that we have. Okay. So this is given within 4 hours, right? So snake bite हुआ उसके 4 hours तक, ideally this will be effective. Okay, this is all you don't need to remember, but this is produced by all of these institutes. It has a shelf life of 5 years. How do we give it is important. So this comes as a lyophilized powder. So now read this. So what I'm going to do is I'm going to dissolve each vial into 10 ml of distilled water. Okay, and this is basically given over normal saline as infusion over 30 minutes. Okay, so just remember कि उसको dissolve करना in distilled water and then you give it as infusion. So 10 vials should be dissolved in 100 ml distilled water and added to 400 ml of normal saline. So we use up to 10 vials of this anti-serum, anti-snake venom. Okay, so this is what we are using. Fine. So this was about snake. Where do you study these two buzzwords? Yeah, so this is the poison cathardin and it causes priapism. So anytime there's priapism, this is about Spanish fly. Yeah, I'll quickly tell you what is 20 WBCT. So this is something that we use for vasculotoxin. So this is used to identify vasculotoxin, right? So this is 20 WBCT, which means that you just take 2 to 3 ml of blood. 2 to 3 ml of blood le lo and you let it sit on a test tube. Normally, if it is our blood, what will happen? It will clot, right? You let it sit for 20 minutes. But here, those who have hemolysis, vascular toxin, will it clot? No, this will not clot. So when the whole blood clotting time is more than 20 minutes, that is a sign of viper toxicity. Understood? So that is a test that we have, which is 20 WBCT. Okay, so Spanish fly. What about scorpion? Scorpion ka species is Mesobuthus. It produces an autonomic storm by producing sudden. I have not seen RRR. Is that okay? Can I still live in this world? I have not seen RRR. I have not seen Arjun Reddy. Yeah, can I still, am I livable human being? Yeah. Auto sympathetic, parasympathetic. I have somehow I don't feel like seeing only. And people talk about something too much, na. I feel like being a rebel. मुझे देखना ही नहीं है. I don't know why. So sympathetic, parasympathetic. Okay, so this is about that. Drug of choice is what? What is the drug of choice for this? Yeah, it is prazosin, right? So this is prazosin. Okay, right. Okay, then we go to plant irritants. So there are the plant irritants. इनमें आपको picture देंगे and they'll ask you to identify. So these are the tox albumins or phytotoxin which will cause RBC agglutination. Okay. So RBC agglutination कौन करता है? There are three things. ACR. So there we have this American College of Radiology that we have. So it's ACR. So A से Abrus precatorius, right? Abrus precatorius, which has abrin. Then we have C. C से क्या है? Croton. And R से क्या है? Ricin. So these are three things. What is the toxic level? So just remember 1, 5 and 10. Okay, so 1, 5 and 10. So itne seeds खाओगे, it will be fatal, right? So 1 seed, 5 seed, 10 seed is what you want to remember. Okay. Quickly going on to identifying. This is something that has been asked a lot of times. FMG exam, very favorite. So A से शुरू किया था. So this is Abrus precatorius. सारे नाम पता होना चाहिए. So all the other names are Ratti, Gunchi, Jacquetti, Mulethi, Licorice. Everything which is ending with E is Abrus. Okay, so this is also used as sui. One more E. So this is used as cattle poison. No, so needle बनाते हैं. So sui is arrow or cattle poison. So this is what is your Abrus precatorius. So this is used in malas also, right? So if you want to kill somebody, just take one from mala and give. Okay, like that. So this is your Abrus precatorius. Active principle क्या है? Obviously abrin, right? Abrin. Yeah, so this is, will you recognize this? है ना? Beautiful mala and low cow. All right, Prashant. The Abrus precatorius. On the other hand, also called as Jamal Gota, what is this? Croton, right? So this is your croton that you have, which is very brown, dirty brown. है ना? तो Jamal Gota बोलते हैं, this is used as a purgative. Okay. And what is this? This is ricin, right? So this is ricin, which is also called as castor, है ना? So all the plant is dangerous. This is your castor ka flower and plant, except what that you use in general life also for alopecia. Some people use for stomach ache. They use. So this is castor oil, which is not poisonous. All right. So this is actually a biological warfare agent. So it looks like a cockroach, ना? तो ऐसे राइसिन और कैस्टर दोनों मिला के कॉकरोच बन जाता है. Yeah, everything is poisonous. Seed, flower, stem, except for oil, everything is poisonous. So this is your seed. ठीक है, सीड तो पॉइजन है ना, एसीआर में देखा ना, इट इज फाइटोटॉक्सिन, 10 सीड्स आर फेटल. ठीक है, विल यू आइडेंटिफाई ऑल ऑफ देम गाइस? दिस इज वेरी ब्यूटीफुल. एब्रस, क्रोटॉन इज वेरी रफ, क्रोटॉन रफ, कैस्टर एंड राइसिन कॉकरोच. ओके, what to write in CC, ये सब तो you have to see images. This entire PDF you have to revise. ये क्या है? This is very 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 important. ये तो आएगा ही आएगा FMG एग्जाम में. This is semicarpus. What is the active component? Bilvanol, right? So this is called as what? This is called as marking nut. So now tell me, this will also produce a bruise. How do I distinguish this artificial bruise from a true bruise? What will be the two buzzwords you will tell me? Very nice. This will produce vesicles and this will be an irritant. This will produce itching. Very good. Okay. Then what is this? Looks like a queen, right? So this is what is, this is Calotropis, right? So this is mother, basically queen. So this is also called as mother. That is how you can remember. Mothers are queens, right? The Calotropis. So this is your queen shaped heart. So this is arrow poison, cattle poison, infanticide, snake poison. सब कुछ को मार सकता है. Arrow, cattle, infanticide, snake, everything it can kill. Queen. Okay, crown shaped. Okay, what is this? What are the seeds which look similar to datura seeds? ऐसा एक inward सा embryo जैसा shape होता है, and they cause this Yunnan hands, red hands हो जाते हैं. So capsicum, right? So we're talking about capsicum seeds. All right, so this is your Hunan hands. What is this? Correct, this is rye, right? Rye bread milta hai. So this is ergot. So ergot is the poison. Ergot is a vasoconstrictor, isn't it? It's a potent vasoconstrictor. It produces the black hands, complete ischemia ho sakta hai, black hands, called as claviceps purpura. Saint Anthony's fire. Because of vasoconstriction there will be a lot of pain, neurogenic pain. You will also have tactile hallucination. So here I want you to remember three things which produces tactile hallucination. Very important. Magnon bugs. What is this? Cocaine. Remember, cocaine, magnon bugs, very important. E से ergot अभी देखा, A से arsenic. So three things which produces tactile hallucination. Okay. Next category, cardiac poison. This is the ideal homicidal agent. There is one Netflix series, I don't know if you have seen that, Ginny and Georgia. उसमें ये टॉक्सिन यूज करता है. So this is aconite, right? So this is aconite, which is मीठा जहर, sweet poison we call it. Monkshood. इसका root is monkshood basically. They can give you this as image based question also. So monkshood is the root. It's very very sweet. Okay, so this is the flower. They can give you flower का भी. Tandav I have not seen. Tandav तो इतना अच्छा भी नहीं था. This is this blue thing, all right? So this is the flower that you have. So what will be the manifestation? So because it's homicidal. Why homicidal? Because ऐसा लगेगा कि cardiovascular cause से death हुआ है. So it mimics cardiovascular causes, right? So paresthesia would be the earliest, but after that you have hippus, you have hypersalivation, hypotension. So I remember this as hypotension. Remember hypotension, it is hypotension and it has hippus. Okay, so hippus is what is hippus? Batao. Hippus is when you have alternating meiosis and mydriasis, right? So that is called hippus. So hypersalivation and everything will happen in arrhythmia. So people will think you have died a normal death. Okay, so this is ideal homicidal agent. Aconite, very very important. Two more plants that you want to know. Nerium odorium. So this is white, है ना? Pinkish white है. So this is white oleander. On the other hand, Cerebra thevesia, yellow है. Yellow oleander, right? So look at what we have to study. सांप को देखो, प्लांट्स को आइडेंटिफाई करो, डिजीजेस आइडेंटिफाई करो, फार्मा पढ़ो, एवरीथिंग, राइट? सो दिस इज प्लांट्स आल्सो दे आस्क यू. सो रिमेंबर, पर्पल है तो एकोनाइट है, व्हाइट पिंक है नीरियम, येलो है तो सेरिब्रा. ओके, देन other cardiovascular poisons or plants, just remember the names: Nicotiana, Cerebra, Digitalis or foxglove, quinine, hydrocyanide. All of these are things which is this. Okay, What is bad word in Tamil? Has something which I said. Alright, spinal poison. Okay. Then spinal poison is strychnine. Okay, Thevesia. Good. We are learning a lot. Ever if we go in Tamil Nadu and we are not happy, we know what to say. Okay, strychnine. Right. So strychnine is what is strychnine? What is the active agent in strychnine? Last side denotes all the other cardiovascular poisons, all the other cardiac poisons. Okay. Strychnine is, what are the active agents? जल्दी जल्दी बोलो. In strychnine, brucine. Yeah, so brucine and strychnine. Brucine and strychnine. Strychnine itself is this. What is the plant's name? Plant's name is Nux vomica. Right, so we call it Nux vomica. Strychnine and brucine are the active agents here. 1.5% each. दोनों 1.5% होता है as active agents. It comes as this RBC shaped disc. Do you see how it looks like RBC? And how many seeds are fatal? One seed, right? So one seed crush and eat, it is fatal, right? So you only need one RBC to kill you. Mechanism of action is post-synaptic glycine inhibition. Very, very important, because this you will always mark it ulta. So remember, post-synaptic glycine inhibition. So because glycine is an inhibitory neuron, when inhibitory neuron is blocked, what will happen? You will have a lot of excitation, isn't it? So that is called as release excitation at the anterior horn cells of Renshaw's, right? That is where it happens. Test, Wenzel. Quickly remind me, where did we study Wetzel test? Yes, Wetzel is carbon monoxide, Wenzel is strychnine. All right, so strychnine में ना आता है, strychnine, Wenzel. Sonechin test, बस उसी का. Then what will it cause? Because so many muscles are undergoing this contraction, opisthotonus. So when you have curvature like this, you know chakrasan. How many of you can do chakrasan in yoga? So chakrasan, if you do chakrasan very nicely, people will be like, oh wow, such a good chakrasan. So then you say opisthotonus, right? Oh wow, OP, your OP. So opisthotonus is this chakrasan. On the other hand, emprosthotonus is ulta chakrasan, like this. This is emprosthotonus. And when you go to the side, pleura is on the side, so lateral curvature is pleurosthotonus. ठीक है? This is the bittermost compound, so you can't have it ऐसे. पानी में मिला के नहीं खा सकते. You have to mix it with alcohol or something कड़वा so that you cannot see. Okay. Treatment. How do you treat this? So one is acidification of urine, and yes, you have to give anticonvulsants in the form of diazepam. ठीक है? Okay. Thank you. So this is strychnine. Strychnine का DD कौन है? Tetanus, right? So tetanus is the DD, और tetanus में क्या होगा? Tetanus is gonna have synaptobrevin, right? So synaptobrevin acts where? Correct. So synaptobrevin is gonna cause pre-synaptic inhibition, right? And what will you have here? You will have lockjaw, and then you will not have all the muscles simultaneously undergoing contraction. You will have a gradual contraction which proceeds. Okay, so this is about tetanus. Yeah. Then you have few neurogenic toxins also. So conium maculatum, I'm sure you've heard, जिसने hemlock, basically Socrates को मारा था using hemlock. So this is the plant which is conium maculatum, and curare is the other peripheral nerve poison. Conium से एक और चीज याद रख लो, that this has a carrot smell. Carrot जैसा लगेगा, carrot smell होता है. Okay, so these are two peripheral nerve poisons. Now going on to non-metallic poisons very quickly. 15 minutes, we want to do 30 slides. Can we do it? Yes, this is phosphorus. Phosphorus is of three types. You have white phosphorus, yellow phosphorus, red phosphorus, which is the one which is non-toxic. रिवाइज करो, हो जाएगा यार, डोंट वरी. रेड इज नॉन टॉक्सिक. मैच स्टिक्स में होता है ना, मैचेस के डब्बे नहीं जलाते हैं, साइड में जो रेड रेड है, दैट इज योर नॉन टॉक्सिक फॉस्फोरस. ओके, वेयर इज दीस टू आर टॉक्सिक. सो इट्स अ प्रोटोप्लाज्मिक पॉइजन. इट हैज गार्लिक ऑर्डर. थ्री थिंग्स हैव गार्लिक ऑर्डर. द न्यूमोनिक इज ALP. सो AL से क्या? ALP is the first thing, aluminium phosphide. Second is arsenic. Third is phosphorus. And now just remember ALP, three things which have a garlic odor. Will you remember this? All except question आएगा, सही मारोगे? Very good. So garlic odor. Then phosphorus has everything luminescent. So vomit, fecal matter, luminescent आएगा. Smoking stool syndrome बोलते हैं. Yellow, no, not thallium. Yellow fatty liver. Fatty liver भी also. So remember, everything is shiny. And this is used as a Diwali poison. What it produces when you inhale phosphorus fumes for a long time? So this is via inhalation. This is called as phossy jaw, right? So this is your jaw necrosis which happens, which is your phossy jaw. Antidote क्या है phosphorus के लिए? What is the antidote for phosphorus? Yeah, the antidote for phosphorus is a toxin in itself, which is copper sulfate. So इसको तो treat करता है, but copper sulfate खुद ही खराब है. So garlic smell किसमें? ALP, AS and white phosphorus. Okay, white phosphorus specifically. So going on those same lines, the one which was antidote to something but itself is a poison, copper, right? So copper sulfate. Copper is gonna turn everything blue, so this is called as blue vitriol. It causes hypersalivation. So hypersalivation is dialysis. It can cause acute hemolysis, also very important. It can cause ILD, a granulomatous interstitial lung disease, which is called as Vineyard sprayer disease. It can cause Clapton lines. So gum lines which are blue, a lot of other things will cause, but this is also one of the causes. Child causes lentis. Lens पे line बन जाएगी. And what is this? This is your Kesher-Fleischer rings. है ना? Wilson's में भी तो copper ही है. So this is the Kesher-Fleischer rings that it can cause. Antidote इसका क्या है? The antidote to this, so potassium ferrocyanide, very very important. So potassium ferrocyanide is the antidote to copper sulfate. Okay, so will you remember all of this about copper? Going on to the next metal, it has we call it as metal fume fever. It can have malaria like chills. Baki bhi hai, but these are specific antidotes. Correct. This is zinc. So with zinc, I want you to remember three things, three M's: metal fume fever, malarial chills, and Monday morning fever bolte isko. So Monday morning fever is with zinc. If they tell you कि Monday morning को chest tightness हो रहा है, what is the disease then? Yeah, that is byssinosis. So Monday morning chest tightness is associated with byssinosis, which is a compound which causes byssinosis is what? Cotton, right? So cotton dust which causes this. And if they tell you Monday morning headache, this is because of tolerance. No, tolerance which develops to nitrates, and that tolerance is lost over the weekend. So you again start to have headache. So very important. So these are three Monday mornings that I've integrated for you. Do not mix them up. Okay. Diagnosis: when you have this bent bone disease, it's so painful that we use the term ouch, ouch. What is the ouch, ouch word ka Japanese term? It's called as itai, itai, right? So itai, itai is ouch, ouch, because the bones are all bent. So this person has pain. So this is all triad of cadmium toxicity. Kya triad hai? One is bone pain, ouch, ouch. One is PCT necrosis. Can you tell me one more thing which we have learned that causes PCT necrosis? Proximal convoluted tubule. Good. Carbolic acid. And what does it do to the hair? Golden color hair. Can you tell me one more area where we will see golden hair? Good. Arsenic. Na arsenic mein ho jayega. Very nice. So this is about cadmium. More specific is itai itai or ouch ouch. BAL is an antidote. It is contraindicated in two things. Remember CI, cadmium and iron. So cadmium and iron toxicity mein BAL is contraindicated. Okay, that is what I wanted to remember. We'll go to thallium. Abhi aayenge. So what does thallium do? Instead of pigmentation, we will lose hair. So thallium is the ideal homicidal poison because it mimics gastroenteritis, neuropathy, but it has a specific sign. Last year NEET question. There is alopecia. In the history, they will give you alopecia. Plus, what is cygneted sorcel? It means that you start to lose the hair of your eyebrows, madarosis. Eyebrows ke hair jayenge. That is something which is very, very specific to thallium. The various DDs could be Guillain-Barré, porphyria, because you are having neuropathy, right? So that is why these are the differentials. इसीलिए arsenic में भी होता है, but more specific for thallium. Okay? अगर exam में दे रहे, they're asking thallium. ठीक है? Something very common, they don't even ask you this now, lead toxicity, right? So this is usually with old house, painters ke associated hai. Chronic toxicity is called plumbism or saturnism. In FMG exam, this is asked so many times. Plumbism, saturnism mein kya hai? It is chronic lead toxicity. What are all the features? Quickly tell me ABCD. What are the features you will have? Anemia. Along with anemia, microcytic anemia hota hai. What kind of finding you will have? You will have basophilic stippling. C से क्या हो जाएगा? Constipation and colicky pain, right? Colic. D से क्या होगा? You will have drops, neuropathy, wrist drops, foot drop. E से क्या होगा? encephalopathy. Chronic में you will have encephalopathy, and F से earliest sign you will have facial pallor, right? So facial pallor हो जाएगा. This is the earliest sign that you have for lead toxicity. In addition, you will have these metaphyseal white lines that can be seen. And what are these that we had seen in copper also? These are Burtonian lines that you can see, right? It can also cause gout. Correct. ठीक है. Antidote क्या है? Calcium disodium personate. This is the specific antidote that you want to know. So these blue lines, how to distinguish from scurvy? Scurvy is not even, scurvy doesn't have white. See, again, scurvy, remember, there's so many other things. Bone density all is normal here, right? So just with the white metaphyseal line, everything else is different. No, bone density itself is normal here. Okay, right. The value wise, just remember, you can remember this entire table, but if you want to remember one, just remember clinical symptoms will appear at what level? 70. More than 70 microgram per deciliter, you start to have clinical symptoms. This had come in one of the exams when I was preparing. So suddenly everybody started remembering lead values. Just remember 70. ठीक है. Very very important. सब कुछ ही है दुनिया भर का. Very सबसे busy slide. Arsenic, right? So arsenic again is something which is a very good homicidal poison. This is one of the most commonly used homicidal poison because again it can mimic cholera, Addison's, measles, right? So what all does it do? One, red velvety stomach. So many stomachs, red velvet comes here. Subendocardial hemorrhage of heart. Three tests: Marsh, Reinsch, Gutsi. Garlic odor we already know. Blackfoot disease. One more Blackfoot disease जो हमने पढ़ा था, ergot, right? Ergot and arsenic दोनों go together. It can cause perforation of nasal septum. One more poison which can cause this, cocaine, है ना? Cocaine snort करते हैं, it can cause perforation of nasal septum. Acute में we want to see arsenic levels in liver. Chronic में, this is a question which has been asked so many times. Arsenic remains in the bone for very long time. This can be found out. Urine arsenic levels we can check, right? This is also something which is very important. So arsenic, loads of questions. Nail पे क्या line मिल रही है? Mees lines, right? So we are seeing these Mees lines on the nails. What are we seeing on the hands? This is called as raindrop pigmentation. Yeah, ideal because it will mimic other things. No, people will think अरे इसको बेचारे को cholera हो गया, मर गया, but he's died of poisoning. And what is this? You will see palmar plantar hyperkeratosis. So this can mimic Bowen's disease or any hyperkeratotic disease. Antidote क्या है arsenic का? Yes, freshly made Fe2O3 ferrous oxide, right? Ferric oxide which has to be freshly prepared. Remember that. So this is the ideal antidote. बाकी चीजें भी दे सकते हैं. बाल and all तो हर जगह पे ही है, right? So you need to remember specific ones. Okay, बाल खाली only remember where it's contraindicated. बाकी तो हर जगह है. Okay, so this is the one which is the best. All right, very important slide. चलो फटाफट guys, 10 more slides in 8 more minutes. Can we do it? I think we can do it aram se. Mercury. Mercury is also called as hydrargyrism or Minamata disease. It will produce what? It will produce all of these shakes. Can you see this image? Image based question aa sakta hai. So these are called as Mad Hatter shakes, glass blower shakes or Danbury shakes. Erethism can you hear Zara shouting? She's just shouting. I don't know why. Erethism is psychosis. Shouting literally. Erethism is psychosis. PCT necrosis. One more area which causes PCT. One more area which causes PCT necrosis, which is carbolic acid or phenolic acid. नहीं अभी वो फिर छोड़ेगी नहीं. Carbolic acid and what else? Where else did we do this? Cadmium. Okay, so this is PCT necrosis. It also causes gingivostomatitis. Okay, so gingivostomatitis. I am feeling so tired. I don't know what I'm going to do in this Neuros live. They put this live. Nobody is from Prep Ladder, right? They've done this Neuros live where we have to promote it, and I am so tired. I don't know. Let's see. So gingivostomatitis. Side effects of signing up for more than signing up for a lot of stuff that you're not equipped for. gingival stomatitis will happen. This is something which is a repeat question. Okay, so mercury, out of all the specific things, you will forget this, right? So gingival stomatitis. Baki, it can cause this mercuria lentis or brown malt reflex. It also produces pink foot disease. Can you see how pink everything is pink? It can cause this, and it can also cause this bluish pigmentation. So where all did we see bluish lines? Remember limca, lead देखा था, mercury अभी देखा, iron नहीं देखेंगे, copper already seen, right? So four things where we will have blue lines. Okay, claptonian lines, limca, ठीक है, burtonian line, same thing, same thing. Okay, no, please don't come, just study. Cobalt and manganese, what will happen in cobalt? Just one thing you want to know. C for cobalt, C for cardiomyopathy. Manganese, you must have read this in Parkinson's disease also. Okay, so manganese will have Parkinson's disease. Organophosphate poisoning, most common suicidal agent in our country, right? Most common suicidal agent. Ideal suicidal agent, cyanide. Okay. Okay. Organophosphate will do what? It causes irreversible inhibition of acetylcholinesterase, right? Yeah, of course. I'm coming tomorrow. Tomorrow is your first class, no? So just to introduce, I'm coming for 20th book and all. But I'll go tomorrow. Zara will also come because I have nobody to see her. So I'll have to bring her. Irreversible acetylcholinesterase inhibitor. So this will cause cholinergic increase, right? So cholinergic increase हो जाएगा. So what are all the things? Very easy. ये तो बचपन से पढ़ते हैं, फटाफट बताओ. Diarrhea, everything will flow, right? Diarrhea, urination, meiosis or mydriasis. This is a mistake. I don't know why people make. Cholinergic है ना, तो meiosis, right? Do not get this wrong. We have already done fb.com. So O was organophosphate. B for bradycardia, heart rate will slow down. What about bronchus, bronchospasm or bronchoria? E for emesis, L for lacrimation, S for salivation. So everything flows basically, very useless. Kerosene smell आएगा इसमें से, and you will have red tears because of porphyrins, right? So porphyrins होता है, which is called chromodactyria. To see this, नहीं हो सकता ना, ब्रैडी होगा. RBC cholinesterase, plasma cholinesterase. This is best. This is most common. Drug of choice, batao. Yes, atropine. Just atropine, or along with that, pralidoxime. Oxines bhi denge, right? But when we talk about carbamates, carbamates is reversible inhibition, right? So what do we not give here? We don't give oxines in carbamates, right? I'm sure you all know that. What is the plant penicillin? It is endrin. Endrin is plant penicillin. It causes mydriasis. This is different. Treatment of choice, calcium. Very important, alkaline phosphide, right? So self-phos. So this has a garlic smell, like we've already established. Zinc phosphide has a fishy smell. Remember that. This also causes subendocardial infarction and AFib. What was the other agent जहाँ पे हमने subendocardial infarction देखा था? Not thallium, arsenic, guys. Arsenic. है ना, arsenic देखा था. ये सब रिवाइज करने एक बार. Adrenal injury also it can cause. MgSO4, activated charcoal, paraffin. These are all the things which are there. So how does alkaline phosphate act? It combines again with HCl, and that releases phosphine gas which can inhibit respiratory centers. One test, we can use a filter paper with AgNO3 and that will turn black because of phosphine gas. Okay, so that is it. I'll have to stop now because I have to rush. Okay, the substance abuse things, cocaine और substance abuse है वो हम psyche में कर लेंगे, ठीक है? तो पहली बार we have completed what we set out to do. We have completed so much. Okay, so forensic is almost entirely done. Homework बता रही हूँ फटाफट. IPC sections, bone age estimation, stains, ठीक है? और क्या था? बैलिस्टिक्स, MKT ऑफ बैलिस्टिक्स, ठीक है? तो ये चीज आप लोगों को करनी है. अपार्ट फ्रॉम दैट, डू दैट टेबल ऑफ सेक्स आइडेंटिफिकेशन, सेक्सुअल डिजीजेस व्हिच आई हैव नॉट कवर्ड. These two chapters you have to quickly do. Okay, no more classes today. Tomorrow we have two classes, 7 p.m, 10 p.m. Make sure you are attending both 7 and 10 p.m. I'm going to have quizzes on all of these four subjects जो हमने करे हैं, ठीक है? So 7 p.m is going to be radio quiz, 10 p.m is going to be quiz from PEDS और क्या पढ़ा, ENT, FMT and Derma. ठीक है, तो ये चारों के ही क्विज होंगे, ठीक है, प्रीवियस ईयर क्वेश्चन जो अपन ने नहीं करे वो करेंगे, ठीक है। ऑल राइट, सो दैट इज व्हाट वी विल डू। एक बार और होमवर्क नहीं बोल रही मैं, जस्ट समबडी विल पोस्ट द लिंक्स, ओके। ऑल राइट गाइस, थैंक यू सो मच एंड बाय बाय।